Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Mohamed Alameddine. I'm the Dean of the College of Health Sciences, and it's my ultimate pleasure to be your host in this podcast series titled Health Voices. Why Health Voices? It's our way for the College of Health Sciences, which is the largest college at the University of Sharjah currently, and one of the most diversified colleges, to reach out to you, to hear your voice, and to tell you a little bit about some of the exciting opportunities for engagement that are happening at the College of Health Sciences. We will be hosting distinguished students, faculty, staff, alumni, and policy and decision making and decision makers, and engaging them in interesting discussions that concern us all, irrespective of where we work or what we do. And it is my ultimate pleasure today to welcome a distinguished guest from a distinguished department, who will be speaking about a very interesting topic that concerns us all. My host today is Dr. Mohamed Abuzaid, Associate Professor at the Medical Diagnostic Imaging Department of the College of Health Sciences, and he will be addressing us today about the topic of artificial intelligence and health sciences. A very warm welcome to you, Dr. Mohamed.
Assalamu alaikum wa rahmatullah. Thank you, Professor Mohamed Alameddine, for this opportunity to participate in this first session of the podcast.
So we're starting strong with a topic that I think everyone is interested in, الذكاء الصناعي, artificial intelligence. And my first question to you, what is artificial intelligence?
Artificial intelligence is, to make it very simple to everyone, is when we teach the computer to do the task that the human is doing right now. This task, it could be very easy task, and it can be a very complex task. So this is in a very simple the definition of the artificial intelligence.
Out of this simplicity, many people think that this computer may become smarter than humans and may start taking decisions and actions. Before I go into health sciences as a field, is this something that concerns you, Dr. Mohammed?
Yes, it's not only concerning me, but it concerns even the big companies which is working on the artificial intelligence program. And as I remember, when the Facebook started the program of the chatbot for the first time, they close the program after few experiments, when they start noticing that the chatbot on the trial version develop a language to speak between them, which is something that it could not be understandable to the scientist or the engineer which they are working behind the artificial intelligence. Later on, they tried to solve these issues. But yeah, it's a concern that these computers can manage or can develop their own language to speak to each other.
Thank you very much, Dr. Mohammed. This is interesting. Regarding the prospects of artificial intelligence in health sciences, education, and practice, what do we have currently, and how do you see the future evolving in terms of the healthy integration of artificial intelligence into our professions?
See, Dr. Mohammed, especially after the COVID and the booming of the artificial intelligence, now we notice that most of the students in the classes, they are not using a paper and pens. They are using their devices. And they start using even the artificial intelligence application in generating their reports and doing their assignments and their tasks. For the health care itself, we can notice also after the COVID how the artificial intelligence help in developing the vaccine and different kind of medication. So this is something that we should consider it in our future educational program, and even for our future as a healthcare professionals.
Maybe I'll address your field now, which is diagnostic imaging, the overall field of radiology and diagnostic imaging. Some people say that with the artificial intelligence, many of the workforce in this field would be replaced. Is this true, or this is not accurate?
If we look to the medical imaging as a field that involving many professionals, not only the radiographers and the radiologists, we have the nurses, we have the medical physicists, we have the engineer. And in the past days, this is not much longer, maybe in 2003, 2005, 2007. Until that time, we have someone called in the department darkroom technician, who are responsible of developing the films and processing of the films. And we have the archivers who are responsible about archiving the films in the department. Now, with the digital imaging, these jobs are completely disappeared in the medical imaging department. Now, with the artificial intelligence, there is many programs, many applications are used in two things. Number one, teleradiology, which is we can send the images immediately to many diagnostic centers worldwide, and we can get the response from professional radiologists within seconds. So this has reduced the number of radiologists in the department. Another thing that we have many programs, many applications that now are working as computed aided diagnostic. So they are helping the radiologist in producing the first or the initial report. Many of the radiologists who are working in the artificial intelligence now, they are saying that with in 2030, the number of new physicians who want to specialize in radiology will be very less. The radiologists will be more working with the interventional radiology, not with the reporting, because the artificial intelligence will take apart from their job.
But at the same time, everyone speaks about the human factor being non-replaceable by any means.
Yes. So this is why I said that the artificial intelligence will write the report, the initial report, and the human will come and then will support this report or maybe modify the report. Now there is a artificial intelligence program working with the COVID cases, and they reached to the accuracy of 99% accuracy. I'm sure with this development and advancement in the future, this 99% will reach almost 100%.
I'd like to zoom again into the field of education. Many students are excited about ChatGPT and other variants of artificial intelligence helping them with preparing their coursework or assignments. How do you envision us as educators, and more specifically health sciences educators, integrating AI into our educational programs?
I will give you my experience. The ChatGPT is very good in developing improving also the faculty member feedback and reflection to students' work. It will be very difficult for the faculty member to detect how the students generate their reports or their assignment. Although there is many programs now they can do that. But the students also, they are so clever and they can rephrasing or reproducing the reports which is come from the artificial intelligence program like the ChatGPT. But we as educator, we should involve more in using the ChatGPT and these programs in developing a constructive reflection and feedback for the students, which they can use it in their future to progress more, improve their skills, and improve their knowledge.
So I hear you saying that we should find a way to embrace it in a healthy way where we can improve and enhance our educational offerings. Do you have any ethical concerns regarding the use of AI, either in education or in practice?
There is many ethical concerns about using of the artificial intelligence. In healthcare, we should take care more about the ethical concerns regarding the patient data. Because to produce application that using artificial intelligence, we need to use the patient data. So we have to make sure that these patient data are safe and with the permission of the patient and with the permission of also the health institutes. Also, it will have some relation between the patient and the doctor. So the ethical concerns here are very important, and many institutes now they created a committee which are responsible about the integration of artificial intelligence in their work practice. In education, again, we have to look to develop a policy and regulation about using of the artificial intelligence program in education, similar to the one that we use it now for the research. You notice now when you submit your paper to any journals, they will ask you many questions about did you use artificial intelligence like the ChatGPT in creating the text or in analyzing. And as I know, I'm not sure 100% that now even the ChatGPT has become one of the authors in some papers.
So it could be a disruptive innovation that could maybe restructure our way of engaging with our students, as well as engaging professionally with patients. My last question to you, this topic can take hours, but
yes.
My last question to you, what is the future prospects of artificial intelligence that you can see vis-a-vis the practice of health sciences?
For the health science professionals, now we have to look to the different disciplines. For example, in medical imaging, we have to teach the students the basic of artificial intelligence and how this artificial intelligence is involved in their practice. Maybe for the nursing, it's very important in the decision making, because there is many programs now, artificial intelligence program, that are used to help the nurse to take a decision. So this is also something that the nursing students should be taught and should be they should have the knowledge and the skills to understand these things. Yeah.
So it depends on disciplines, but I hear you saying that the advantages outweigh probably the risks or disadvantages. Is this something a note that we can conclude on?
Definitely the advantages is more, but the risk, especially for some health professionals, is more. As I told you, the top 10 health professionals will be affected by the artificial intelligence in 2030, as many reports, radiologists or the histopathologists also, because the computer will take part from their job.
Could we see in the near future maybe a course for the public that can educate them on, especially for health professionals, on how they can integrate artificial intelligence into their
public or for the healthcare students?
For healthcare students and in-service professionals. Could we see something like that?
There is many programs. Even some professionals body, they start requesting the universities to add artificial intelligence in their program, like the Health Professional Council in UK. They put a new guidelines for many professionals to educate the undergraduates and the postgraduates about artificial intelligence.
Well, you educated us today about this field.
Thank you very much.
I can't but thank you very much, Dr. Mohamed Abuzaid, for sharing your thoughts. I'm hoping that we can get you later on this series to discuss further this topic, which may not be concluded in one podcast.
Inshallah. Thank you very much.
Thank you very much. I thank all the audience for listening, and please feel free to engage with us by commenting on this podcast. Thank you very much.
Thank you.